Good afternoon, ladies and gentlemen, colleagues, our partner around the world. I am Professor Temelkovsky, past president of Macedonian Association of Orthopedic and Traumatology, past president of the Balkan Association for Knee Surgery and Arthroscopy, and chief of department of Orthopedic Clinic in Skopje, Republic of Macedonia. It's my pleasure to tell you that I use hyaluronic acid maybe 10 years, especially 10 years only in early stage of osteoarthritis of the hip joint. And I use Optivisc last 5 years for the same reason. And about the knee joint, the history of using of hyaluronic acid is very long. And it was very interesting how to do what is the indication about hip joint, because the swelling of the hip joint we cannot recognize by radiography, but pain, it means early stage characterized with synovitis inside of the hip joint, is very interesting. It is a first symptom and the first stage of osteoarthritis. It is the reason why I use hyaluronic acid, because my technique is the mixture with anesthesia, local anesthesia with lidocaine, xylocaine, and around the capsule I put cortico, decomedrol or something like that, and hyaluronic acid inside of the knee joint. What is the advantage of this technique? It means, first of all, with the cortico we increase the pain, increase the swelling of the joint, and increase the synovitis. With anesthetic, local anesthetic, and together with cortico, we put the big volume of the liquid inside of the joint, and with Optivisc with 3 milliliter, it means maybe 6 or 7 milliliter liquid is inside of the joint. It means we put inside Optivisc. Optivisc is characterized with 3 to 5 million Dalton in the similar way like normal synovial fluid. It means the result is very good, especially when you measure the pain with the VAS scale. The result is very good. It means 1 year the patient is without pain. The Tegner score, release score, is increased in this kind of patient. It's my pleasure now to present you some of our cases, especially the patient with 55 years old with early stage of osteoarthritis, even though he have impingement of the hip, femoral acetabular impingement, but it's all that is not be very useful to make some kind of arthroscopy to solve the problem. And we decided to put only Optivisc inside with mixed with the cortico, and the result it was fabulous, because the pain and synovitis it was decreased, and VAS score it was very successful. And the second patient is very young patient, the girl with 22 years old with femoral acetabular impingement, and in this stage the indication is first arthroscopy to solve the problem with the impingement of the hip joint, and in second stage we put Optivisc inside of the knee joint. Now we have a problem with another hip joint in the same patient. It means The first hip is very good, without pain, without any swelling, without synovitis, with range of motion very good. And the second hip joint, it means the indication is the same, arthroscopy and then application of the Optivisc. We use Optivisc in the case of the aseptic necrosis of the hip joint. After the core decompression, it means during the operation when we finish with decompression, and we use inside of the joint Optivisc single. It depends of the stage of aseptic necrosis. The result may be excellent when we use core decompression in very early stages, and the result will be acceptable when you use core decompression in stage 3 of aseptic necrosis. Even though the stage 3 we have the result, it means with the prolongation of the total hip prosthesis, we save the biologic hip without pain. 1 or 2 or 3 years, is depend of the patient. Dear colleagues, thank you very much. It was shortly presentation about the indication of the application of hyaluronic acid, especially hyaluronic acid in the hip joint, with 3 or 5 million Dalton. A useful procedure, especially in early stages of the osteoarthritis of the hip joint.